Welcome to the Health by Haven podcast. I'm your host, Haven Quinlan. If you're a multi-passionate wellness enthusiast, then you're in the right place. I'm obsessed with learning as much as I can about the wellness world, and I want to share that with you. Each episode will dive into various aspects of health and wellness through inspiring and informative guest interviews with some solo episodes thrown in. Tune in for all things health, and let's have some fun, shall we? Dr. Lawren Honken is a wife, mom of 3, and a board-certified obstetrician-gynecologist currently practicing in the Southeastern United States. She is also a certified menopause practitioner and is completing a fellowship in integrative health. She serves her patients as a trusted resource, providing medical education online while advocating for patient autonomy and informed consent. Her goal is to simplify difficult concepts in women's health, and for those interacting with her online to feel like they have a friend who is also an OBGYN. She provides so much helpful information in today's episode on women's health and how to advocate for yourself in the healthcare industry. If you like today's episode, be sure to follow her on Instagram at yourfriendtheOBGYN for more great information like she shares in the episode. And be sure to share this episode on your social media or with someone who you think could learn from her. Lawren, thank you so much for coming on the Health by Haven podcast today. I am just so thrilled to chat with you.
Yeah, thanks so much for having me. I'm really excited.
I want to start with the basics here. Talk to us about a day in the life as an OBGYN. What does it look like? What are you working with patients on day to day?
Oh man, it's so variable. And I think that's why I love being an OBGYN so much because the day to day, it's just never boring and it's always different. So, I mean, I work in the office where I see patients just like for annual exams. So, doing pap smears, breast exams, kind of preventative care type of things, and then managing contraception. So, whether that's like birth control or natural family planning or IUD placement or and then I also do procedures, so including like the IUD placement that I mentioned, but I do like treatments for abnormal pap smears, IUDs, endometrial biopsies, things like that in the office. And then I have OR days where I am in the operating room and doing things like a hysterectomy, potentially tying tubes, doing like an ablation or treatment for a miscarriage, like a DNC. And then I have days where I'm on call. So usually my call is a 24-hour call. So I'm on call usually from 8 a.m. to 8 a.m. the next day. So that's when I deliver babies, take care of anybody that's coming into the hospital in labor or getting induced or has a scheduled C-section. And then on that shift, I'm also taking care of like anybody that comes into the ER, like has an ectopic pregnancy or has really heavy bleeding and needs like an admission or emergency management or anything like that. And also manning kind of our OB emergency department. So anybody that's pregnant that's coming in with issues or complaints or concerns, I'm like seeing them and making sure they're okay before I send them home or either admit them. So a lot of stuff.
Yeah, that is a big job. And it sounds very busy and very overwhelming to me. So,
Yes.
what made you interested in wanting to go into this?
Oh yeah, I don't know. A lot of things. I think really there were just so many influencing factors that just all kind of culminated with me choosing OBGYN. It's not anything that I knew that I was going to do from day one. I kind of was interested in medicine just because my younger brother had cancer when we were growing up. He's fine now, thankfully, but we were in the hospital a lot, and so I got to see like how nurses and doctors, just healthcare workers in general, interacted with our family. And I mean, we came to like love our like nurses and doctors and just other healthcare workers, and I just had a really great respect for them, and thought, that would be a really cool career one day. And then in college, I had a good family friend that he owned a free clinic, and knew that I was interested in medicine, and he was like, "Well, do you want to just volunteer at the free clinic? You can work with the doctor there, just see if like that would kind of be what you want to do, so then you can figure it out." And I was like, "Yeah, that'd be awesome."
Mm-hmm.
So I volunteered at a free clinic. I went to undergrad at College of Charleston, and so I worked at a free clinic in my free time there, and just seeing like the doctor there, and he did general kind of everything. So he saw kids and adults, and he did family medicine, and so um I just really admired him and just saw the way that he like communicated with patients, the relationship that he had with patients, how he really cared and was just able to make like a huge difference in patients' lives, how thankful that they were. And I was like, this is so cool that this is like someone's job. So I think from there I was like, okay, I want to be a doctor. Like this is something that's interesting to me. And then through like medical school and everything, you get exposed to a lot of different specialties, and some people come in with an idea of exactly what they want to do. I thought I was going to do something pretty general like family medicine. But yeah, I just ended up choosing OBGYN because um, the variety, I really like that a lot.
Mm-hmm.
Also, I think OBGYN has everything that I was looking for as far as like when I was thinking about family medicine, I really wanted relationships with the patients throughout their lifespan. And so I get that as an OBGYN. I wanted to be
Mm-hmm.
able to do procedures or surgeries. And I get to take care of women like that are really young, they're just getting their period and maybe contemplating like birth control, or they're about to start a family, and I get to like walk through that with them, deliver babies, and then go through menopause with women and postmenopause and all that. I mean, it's just so I see patients from like 14, 13, 14, all the way to like 70s, 80s. I mean, it's a really cool job.
Yeah, such a wide range there. And I love that you hit on multiple times just in that the relationship aspect of it. I think that, a lot of times it's hard to find a doctor that you feel really comfortable with. Everyone in the medical profession is so busy and so many people need help and care that I know a lot of times you might feel like boom, boom, in and out with people that you see. And I know that you feel just from following on Instagram, I know that you feel
Yeah.
so strongly about really taking the time with your clients and or with your patients and caring for them and understanding, what they need. So maybe can you talk to us a little bit about your philosophy behind that and like, I mean, tell everyone about the social media as well and what inspired you to kind of spread the word.
Yeah. So I mean, I definitely don't have it all figured out as far as the patient care aspect. I mean, I think there are some really big struggles, especially right now, that physicians are facing, just in the way that we know that patients deserve to have care and the way that we want to give care, but how limited we are by the system in which we work. So
Mhm.
I work for a healthcare system. And in that system, I'm in an office working as an OBGYN, but I'm employed by a big healthcare system. So they they pay me, they give me a paycheck, and the goods that I exchange or the services I exchange, or I agree to be, you know, X amount of productive for them. And so that is based on something that's set by Medicare or in general the government and insurers. So they tell us like, okay, if you do this amount of work, we'll give you this amount of money. And so there's like a calculation basically that works that way with insurance as well. And so obviously the healthcare system is overall a for-profit system. So even if
Mhm.
you work for a not-for-profit healthcare system, I mean they still are a business, so they're still they have to be profitable. They have to keep the lights on. They have to pay staff. And so to do that, you have to do a certain amount of work. And so by that, usually what happens is, we're required to have really short visits to be productive. So,
Mm-hmm.
um, I just have so many thoughts about this, and I'm gonna try not to get on my soapbox about it. But no,
No,
I
this
mean,
is the time. Go
yeah.
for it.
No, I mean, it makes care really challenging. I mean,
Yeah.
it makes it really challenging to collaborate with a patient, but also just to figure out what's going on with someone, especially if they have a complicated history or they are presenting with an issue. And so, if you're seeing someone that's been seen by multiple doctors, they're having multiple complaints, they don't really know what's going on, no one's gotten to the bottom of it yet. I mean, that takes so much time just really to
Mm-hmm.
listen to someone and kind of go through that story, but also to dissect and peel back kind of all the layers, trying to figure out, what could it be? And just a lot of a lot of medicine is a lot of critical thinking. And that's the part of medicine that is so awesome, that is kind of like using your more academic brain. But
Mm-hmm.
a lot of that I think is stunted by just such a short visit. And so a lot of what happens is you just get crammed down into this algorithm where it's like, okay, like, this is the goal of the visit is an annual exam. And so your insurance is only going to pay if we do an annual exam, which means preventative care. So that means that we are talking about like we're doing your pap smear, we're doing your breast exam, we're making sure like all your vaccines are up to date, that you're like wearing sunscreen, wearing your seatbelt, if you're sexually active, we're screening you for STDs, and then that's basically it, like making sure you have a normal period, and that's essentially all that is. And so when you look at it that way, it's like, okay, that makes sense. That could be done potentially, in close to 15 minutes, maybe. But that 15-minute visit that people are scheduled for, that includes like their arrival time, the time you get pulled back from the waiting room, then they go to the bathroom and we get a urine sample, then they go get their vitals taken, then they're roomed, and then, a nurse or a medical assistant is kind of getting their history, reviewing all their meds, taking their vitals. And I mean, right there, all that stuff takes easily 15 minutes.
Yeah.
And then a lot of what doctors do is like I mean, you're trying to establish a relationship or a therapeutic alliance in a really short amount of time. You're trying to gain someone's trust in a really short amount of time so
Mm-hmm.
that you can give them the best care possible, because no one's going to tell you the truth unless they trust you.
Right.
And you can't really help someone as, optimally if they're not going to tell you the truth of what's going on. And
Yeah.
so, and a lot of it too is just, letting patients know that it's safe, and it's safe for them to be vulnerable and kind of tell you what is really concerning them. And but that takes time. So
Yeah.
yeah, it's really frustrating. I mean, I think there's not really a good answer, but I think that's why we're seeing a lot of physicians go outside of the corporate healthcare model, where you're seeing people that are either becoming fee for service or like concierge medicine, or maybe direct primary care or direct care. Um, I mean, because those doctors are kind of taking back control over their visits and their time and everything. But
Mm-hmm.
then that also, it's not, you may not be able to serve people that are not able to pay you. So
Right.
it's just a difficult situation.
Yeah, absolutely. Well, and I think it's helpful for people to hear it from the other side of the table. I mean, I am not a
Yeah.
doctor, and so, I mean, when you're going to visits and if you can easily get frustrated and not think about the other side of things of like doctors don't necessarily want to like rush through things either. And so like the piece that you mentioned about like make sure you're actually opening up and like telling them what's going on rather than like skirting around it, that can also help patients get the best care in that allotted amount of time as well.
Yeah, absolutely. I mean, I think to understanding how to like optimize your visit
Mm,
or the time that you do have, I think is where patients can make sure they're kind of getting the most out of, you know, we both have to kind of play the system. Like this is
Mm-hmm.
what for now,
Yeah.
this is where we're stuck. This is the situation that we're in. I can't change it. I mean, I'm just one person. I can do my part and do the best that I can, but like I'm not going to be able to change this healthcare system, and especially it's not something that's going to change overnight. So I kind of just have to accept that and know like all I can do is the best that I can do in the system. And I think that's where the social media piece comes in, is that I just realized through, I think the surprising thing to me about becoming a doctor, and I think the most valuable thing that I have gotten from being a doctor, is just understanding better how to navigate the healthcare system and really
Mm.
being able to advocate for myself, my kids, my family members, like extended family members. Like my grandmother had a stroke. My aunt has had some health problems, as well as my uncle, but just like really helping family navigate the healthcare system, I just realized like there's so much that people just don't know, and they
Right.
don't know about how they can best advocate for themselves. And also, so I don't know, that's kind of where the social media piece came from, is that I was like, maybe if I can like help, if I can show that there is another side to
Mm-hmm.
like physicians, like we hate this system as much as patients do. I'm also a patient in this system, and it's annoying. It's
Mm-hmm.
really frustrating. And um, like we want to collaborate with patients and give them the best care possible, but also giving them some tools to help them navigate the system.
Yeah, well, I love that. And do you mind sharing maybe some of those tools, or like talking a little bit about some of the things that you share on your social media for people who don't follow, which, by the way, I'll link it in the show notes. You guys should go give her a follow. But like, what are some tools people can take going into their next visit to make sure it's most effective?
Yeah. So, I mean, I definitely think, obviously you want to know first, you want to be choosing like a clinician. Let's say like you're going to see your doctor that you've seen multiple times or whatever, or you're picking a new doctor or whatever. You want to do your homework as far as finding a doctor. So a lot of that is going to be like word of mouth, online reviews, talking to people who have actually seen the doctor. Also, I usually, I tell people like calling the office and seeing how easy it is to get a hold of someone, to
Mm,
talk to someone. I mean, that's a huge barrier to care. Like, and just seeing how far out the doctor is booking. Like, and then once you are a patient of the doctor's, like, is it hard to get in? Like, if you have an issue or a problem, is that going to be
mm,
like you're not going to be able to get like an appointment quickly? If you have an issue, you're going to have to go to urgent care, you're going to have to go to the ER. So, I mean, I think those things are important, but also just coming into your visit, knowing, kind of having an idea of what you want to get out of the visit, instead of just showing up and kind of letting it go and flow how it goes. Because I can tell you if how it's going to go if you don't have a plan for yourself, is that your doctor is going to come in and be like, all right, this is what we're doing today. It's your annual exam or whatever, like, or I'm following up on your medication that we started. You feeling okay? And you're going to be like, yeah, I feel fine or whatever. And they're going to be like, all right, cool. Anything you need, see you next time. And
yeah.
that's, it's a kind of in and out situation. So I don't think, as overburdened as the healthcare system is, a lot of doctors are not really looking for a reason to sit there and chat for a long time, or trying to uncover any problems
Yeah.
that you may be holding back. So
Yeah.
I would say, certainly go into the visit knowing like, okay, I'm going to try to get pregnant, or I want to try to get pregnant within the next year. And so that this is something that I want to talk about. Or, I want to make sure, like, I've had abnormal PAPs in the past and I don't really understand what it means, or I don't understand what my follow up is supposed to be. And I just want to make sure that we're on the same page, that the doctor understands, like, I have had abnormals in the past and we're doing appropriate follow up. Or, like, I have a family history of breast cancer. And so I want to know about, like, what my breast cancer risk actually is, and
Mm,
if my screening is going to be the same as like a normal screening, or am I going to have to get increased screening because I have a family history. I mean, I think
mm-hmm.
just thinking about that stuff, or like, sex is painful, or I have abnormal bleeding or weird periods or whatever, but just maybe having like a list, I would say maybe like a 2 to 3 point list at the most, unfortunately. And then just also understanding that if there's a complex issue that you have, that you may have to make multiple appointments. So,
Mm-hmm.
if you're coming to your annual exam and you're also saying like, I want to get pregnant within the next year, can we go over this? Your doctor may tell you, like, yes, you need to come back for a preconception counseling visit. And I mean,
Mm.
I think that can be really frustrating for patients because, I mean, it's so inefficient, right? You're
Yeah.
like, I'm here now. I literally took my whole day off work. You're
Yeah.
running like 30 minutes to an hour behind, and I just want to get this taken care of. And now you're telling me I have to take another day off work to come in here to go over all the stuff. I mean, it's so frustrating.
Mm-hmm.
Um, but I mean, that's how the billing system works. And then, you know, and if you do just talk about it that day, it's going to get billed as what happened in the visit. So you're going to get a bill for preconception counseling, which some insurances consider to be fertility, in
Mm.
quotes, fertility, and they may bill it that way, may get billed that way. And then your
Mm-hmm.
insurance is like, I'm not covering this visit. So now you owe, $300 or whatever it is.
Yeah.
Um, so I mean, I think also just understanding what you want to get out of the visit, understanding like what your insurance coverage is. I think that's hard. And just understanding too that like a lot of people have this same I mean, I think it can feel very isolating when you have a problem or an issue you want to discuss with the doctor because you can feel kind of embarrassed. Like, I'm embarrassed that I don't understand the way like my body works, or I'm embarrassed
Mm-hmm.
that like I haven't necessarily like followed up. I did have abnormal paps and I was supposed to follow up and I never did because I was nervous. And like, now I feel like shame going back to the doctor and I'm kind of like, hey, I'm sorry that like, or, I haven't seen my gynecologist for like 3 or 4 years and I was supposed to have I think I'm supposed to have annual exams. And so a lot of people come in just being like, hey, I'm sorry, or like, um, feeling embarrassed that they don't understand things. And like, honestly, like I really don't care at all. Like I feel like my job optimally is like I'm there to serve as a resource for
Mm-hmm.
my patients, and like how can I best help you? Like how can I help you understand your body better, or how can I help you understand like why the follow-up is important or what you need, or how can I kind of help you get to the place where you're like, okay, this is nerve-wracking, but like I'm going to commit to like I got to get the follow-up so that I don't have a bigger issue down the road. I mean, just those kinds of things. Um and I think too, can be intimidating to go into a doctor's office just because of the way that it's set up too. Like especially if you're a more empathetic person, because you're already considering like, oh shoot, my doctor's running behind. Like it's been like an hour. They're probably stressed out, or, and I'm just here for an annual. They probably don't have very much time. So, I mean, I think part of that too is understanding that like you're entitled to the visit that you're scheduled for,
Mm-hmm.
and your doctor is like, you deserve the care that you are slotted for. So, and to try to not take that on if you notice that the doctor is like stressed that they're running behind or they're seeming like a little chaotic or whatever, just still knowing that like you're there for your health and that you need to prioritize that, and just doing whatever you need to do that.
Love that. So growing up, I think like as a kid, I always thought, okay, you only go to the OBGYN if you're like about to have a baby, or, then you get a little older and you
Yes.
think you only go there for your annual appointment. But like, what are some other reasons that somebody might come and see you?
Yeah, really any reason that you would need to go see anybody related to like your general health or well-being, your sexual health, your menstrual health, um, and for like preventative care. So a lot of times I'll serve kind of as people's primary care through their midlife, like especially if they don't have any complicated medical issues, like if they're healthy, and they're not on really any medications. They're just kind of coming in to get preventative screening. I'll do that. Um, but other reasons would be like preconception. So you're thinking about getting pregnant. You want to go ahead and get an appointment with an OBGYN or have an established OBGYN so that when you do get pregnant, if you have anything that comes up like really bad nausea and vomiting, you start having bleeding, but your first appointment isn't for like several weeks. Like you want to have a doctor already established that you can reach out
Mm.
to. Any like pelvic pain, pain with sex, any menstrual irregularity. So if your period's not normal, or abnormal, or you have period concerns, like you feel like it's super heavy or super painful. If you want to get birth control, or I mean, you can also get birth control online now, so that's awesome. But if you want to consider like an IUD, or if you just have like general questions. So a lot of times I'll see girls for like their kind of first GYN visit, and kind of usually how this happens is like I see their mom, and then their mom
Mhm.
is like, "Oh, my daughter is like 16, and but I feel like it's probably too young for her to see the gynecologist, right?" And I'm like, "No, no, no. Like the goal is that we like, I mean, in an optimal world, we get like a relationship, and then we know each
Yeah.
other. She feels comfortable, and then she can always, ask any questions that she has. If she's concerned about anything, she can come in for a visit and we can kind of talk through things. If she needs contraception, we can talk about that. Or, you know, so most of it is like just getting a relationship and just getting somebody that you trust and that you like, that is going to kind of help you through. And a lot of times too, I see patients for like really non-specific stuff, or like one-off stuff. Like, I mean, I treat anxiety and depression a lot. I treat like PMDD, PCOS, endometriosis. I treat thyroid dysfunction. I mean, obviously take care of people through their pregnancy, and treat menopause and perimenopause. Um, but yeah, it's a broad range of stuff. And I think a lot of like what I like about practicing in a community and being involved in a community is that I know a lot of other professionals and experts where I can send patients if I need to, or I know them so I can reach out to them and say like, "Hey, I'm seeing this patient and they have this, this, this. What do you think? Like, do you think you would want to see them? Do you have some advice about what I should do?" And I think that's also the biggest advantage too of being a physician, is that you really have a network where you have people to reach out to.
Yeah, definitely. So, for somebody who is maybe thinking, like, oh, I think I want to get pregnant, what steps could they take besides like going ahead and finding a doctor and getting that consultation visit, maybe to like help make that process easier, whether it's fertility or whether it's I don't know. I've never had a child, so I'm probably not asking this question very well, but like to support them, set them up
Yeah.
as best possible for that very long journey.
Yeah, yeah, no, I mean, no, I think yeah, that's a perfect thing to consider. I mean, I think like first, if you don't have an OBGYN and you're thinking about getting pregnant in the next year, you want to look and see like where are you planning to deliver a baby? And you want to kind of go from there. Like, okay, I'm going to deliver the baby at the hospital, and I want to deliver at this hospital. I want to deliver at a birth center, and I'm going to deliver at this birth center or whatever. And then kind of going from there to see like, okay, let's say I'm going to deliver at this specific hospital. So I need to look and see what doctors or midwives deliver at that hospital. And that's kind of how you kind of go from, that's probably what I would do if you were trying to get pregnant and trying to find an OBGYN who's going to take care of you. So, then I obviously, you're going to want to make the appointment and then start a prenatal vitamin. So in general, there's so many prenatal vitamins on the market. I'm really working on a resource for patients about prenatal vitamins, because there are a lot out there that claim to kind of give you everything that you need.
Mm.
And there are some that are very, very expensive, or like, the designer or boutique ones that you can get shipped. And I mean, and some of them, like, the companies, some of them are great quality. I'll say, if that's something that you can afford to do and that's a priority to you, I don't think there's anything wrong with going with some of those. But certainly you can just easily get an over-the-counter prenatal vitamin at Target. That's like in the big bottle. I usually like the Nature Made one. And you just want to make sure that it has folic acid in it. So 800 micrograms is usually what I tell patients to shoot for. And then there are some other nutrients that you need to make sure that you're getting. I mean, ideally, we would be getting all the nutrients that we need in our diets, right? I mean,
Mm-hmm.
but that's just not practical for a lot of people.
Mm-hmm.
And so that's why we have supplements and vitamins. And so a lot of grains are fortified with folic acid in the United States. And the reason for that is to help prevent neural tube defects, which is a hole in the baby's brain or spinal cord, which causes spina bifida. And so the brain and the spinal cord, which is called the neural tube, is developed at about 4 or 5 weeks. And when you get a positive pregnancy test, you're usually about 4 or 5 weeks along. So that kind of event has already taken place by the time you're getting a
Mm-hmm.
positive pregnancy test. So you need to make sure that you have enough folate, folic acid stores in your body for a baby to have a healthy neural tube. And there's some evidence too that it helps prevent cleft lip and cleft palate. So we usually recommend that's the big one, but some other ones to consider vitamin D. A lot of us are vitamin D deficient. And then choline is a really important nutrient that we get in eggs that's shown to be helpful for a baby's eye and brain development. And then DHA or omega-3 fatty acids are really important too. So those are the big ones that I would be looking at. And then there are other nutrient requirements and iron requirement goes up in pregnancy and lactation. And a lot of women are iron deficient, especially if they're having heavy periods. About 45% of women are iron deficient that are menstruating. And iron deficiency anemia, so iron, if you don't know, makes basically your red blood cells, which make up your blood. And if you're anemic, or people say like you have low blood or like a low blood count, you can feel really fatigued. You can have all kinds of symptoms, but a lot of people have fatigue, just feel like crap, and um, it's kind of non-specific. And so iron deficiency anemia is a late complication of iron deficiency. So if you can identify that you have iron deficiency and kind of start treating that, that's just going to help improve your outcomes through pregnancy and all that. And then usually, I'll do the other things that you want to consider is if you're on any medication, you want to know, is this going to be safe if I get pregnant? So a big
Mm-hmm.
one, especially that's easy to get now, like over the counter even, is retinol. So vitamin A derivative is not so we know oral vitamin A is not safe in pregnancy, and that has kind of translated over to topical vitamin A or retinol that a lot of people use in their skincare. And
Mm-hmm.
so we recommend that people don't use that while they are pregnant. And then alcohol is a big one too, because alcohol is in our society is very like socially acceptable. And so you want to kind of avoid alcohol when you're trying to conceive. In general, and the reason for that is because when you may not know you're pregnant until you've been
Mm-hmm.
pregnant for a little bit. And so we don't really know when fetal alcohol syndrome occurs. We know that it does occur, and we don't know how much alcohol it's associated with. So that's why our recommendation is kind of like it's best to avoid it, basically. And then
Yeah.
obviously if you smoke, other health habits that you have, or like if you want to make some lifestyle changes and you've been thinking about like getting healthier, or and doing some things, like now is the time to do them for sure.
Mm-hmm. Mm-hmm. Absolutely. I think those are all like really great tangible tips for anybody listening. And I appreciate like all the things about like vitamins and supplements and things like that, and like your iron levels. And I think all of those things obviously can be affected whether or not you're trying to get pregnant. And something else that I think about a lot is like hormone health. So once again, like whether or not you're trying to get pregnant,
Mm-hmm.
obviously we have a bunch of different hormones running throughout our body, and we can have so many different symptoms if they get out of whack. And so I'm wondering if you see a lot of patients that maybe have different hormone imbalances, and if so, like what you do. I know this is like so generalized and it's such a specific thing per person, but like if they're experiencing those things, like some ways they could work to remedy that.
Mm-hmm. Um, I mean, I would say, above all, kind of like the supplement situation. I mean, ideally, like lifestyle is going to be key in any of this, especially in like hormone imbalance or anything like that. So, making sure that you're eating a nutritious, well-rounded diet. And so usually I point patients to like the Harvard Healthy Eating Plate, which is generally like a Mediterranean diet. And then also pointing them to like movement and exercise. So just kind of trying to increase the amount of time that they're active during the day, and then focusing on like specific things as far as like resistance training, so lifting weights and things like that, even though that can be intimidating. And there are definitely a lot of people out there are physicians out there actually who talk a lot about like how to get started with weightlifting and things like that. So and also talk about nutrition, and there are several nutritionists out there and a lot of health people out there that can give you tips in that too. And then so I would just say like first of all, if you have that concern, that's where I would focus. But how to know if you have like a hormone imbalance. I mean, it's such a hormone imbalance, I feel like is such a oh, how do I say it? Just such a buzzword. That's what I'm looking for.
Hmm.
Yeah, such a buzzword these days of like, oh, if you have a hormone imbalance. And I mean, in general, I would say like our our bodies are like designed very well. So the purpose of them is to maintain homeostasis no matter what. Now, obviously, there are times where they don't do that perfectly, and illness and sickness and stuff happens. But a lot of times, our bodies are kind of over time. They're managing and shifting and changing the way that they excrete hormones and other things to keep us healthy. So I will say that is a big thing to know, and the best thing to do is basically diet and exercise. But past that, I mean, ways that you can know. So, certainly if you're having irregular periods, so if your periods are super, super heavy, if they're super painful, if they're causing you to like call out of work, you're in bed, you don't want to hang out with your friends or do anything when you're on your cycle. I mean, that's a red flag that something could be going
Hmm.
on. If you're going, several months without a period and you're not on birth control, that's a concern for sure. I mean, and there can be different things going on like PCOS or thyroid dysfunction. I mean, pelvic pain, classically, we think about endometriosis, and all these things can affect being able to get pregnant or carry a pregnancy. So those are all important things to like investigate or try to figure out what's going on before you try to get pregnant. So I'm glad you brought that part up because that is a big that's usually what I tell people, we usually say if you're under 35 and you've been trying for a year, if everything is working perfectly, I mean about 85% of people are going to be pregnant. And if you're not, then you need to be evaluated. You can always get evaluated earlier. If you're over 35, the time is 6 months. You can always get evaluated earlier. And so we do a lot of different things to evaluate people, but the main red flags to look for are like, are your periods normal? And that just means like, are they coming, usually we say 21 to 35 day cycle. So if you're tracking your cycle, day one is the first day of like your full bleed. And then the last day of your cycle is the day before your next period starts. So that's how you know how long your cycles are. And then if it's predictable within like 3 to 4-ish days, like if you're like, okay, I should be getting my period this week and it comes, like I would say your periods are probably regular and you're probably ovulating. then we want to make sure you're not having like pain with sex. That would be a big red flag. Your partner, assuming like you have a male partner, you're trying to get pregnant that way. Your partner doesn't have any issues with erection or ejaculation. And then, the age and the time constraints. Um, I'm trying to think of anything else. Yeah. But those are kind of the red flags that I would say.
Yeah, absolutely. And I mean, obviously everything's so intertwined with like every part of your health as
Mhm.
well. And so, yeah, I think all these things to consider are so helpful. I feel like I could literally talk to you for
I
hours and
know.
hours. There's
Oh, I could talk about
so
this
many
forever. I know
things.
I could talk about this forever.
Yes, so many things. But for anyone listening who is having trouble finding a doctor that they feel comfortable with, the care that they need, figuring out literally just where to start, even if they've never not had a bad experience, but they've moved or something like that. Like, what advice would you give to people, maybe who are starting over, trying to find a new place of care to really figure out like the best fit for them and the best I don't know, quality of care.
Yeah, yeah, I mean, well, first you want to see, certainly if you're considering like having a baby soon, you want to see where you would want to deliver, and then you want to see what doctors are going to be delivering there. And then also too, you want to check your insurance. So a lot of times insurances will give you like a list of where,
Mm.
what they're going to cover
Hmm.
or what doctors would be in network essentially. So, and then going from there, I would say to crowdsource. So if you have friends that are around your age that have, just ask them, like, hey, do you go to the gynecologist and do you like them? And until you find someone that's like, yeah, I like mine. Another way
Hmm.
to do this is like Facebook groups. So like local Facebook groups, a lot of people will
Mm.
ask like, hey, can you recommend people, or like what do you, and then you can get more specific things as far as like, oh, I really liked this doctor because of X, Y, and Z, or like, oh, I have PCOS, and this doctor like really explained things super well. And then just calling to see like if you can get an appointment and how easy it is to get an appointment. I also like put a lot of stock on like reviews like online. So honestly, if I'm like, let's say I'm just trying to think off the cuff. If I have a friend that is like moved somewhere and they're like, "Hey, I'm looking for a gynecologist and like I need help. I can't find one or whatever." Then I'm just gonna look like Google
Hmm.
gynecologist in their area. And then I
Yeah.
usually kind of just start there and look and see who has the highest reviews and kind of go there and read about them and read the bio, whatever they have on the website. And then if
Hmm.
then I'm usually like looking them up on Instagram to see if they have social media or Facebook. So that then, because I feel like that's a good way to see like if they do, what their like philosophy of care is or things like that. And then if there are, if you know anybody that is, on social media, like I have people DM me all the time that are like, "Hey, do you know any good gynecologists that are like in Atlanta?" And I'm like, "Oh yeah, actually I do." And then
Hmm.
there are some doctors, like some gynecologists on Instagram and TikTok that have lists that are circulating of like OB providers that are like trauma informed and stuff like that. So
Hmm.
those would be the main places probably I would start. Yeah.
Yeah. Amazing. That's super helpful for people. Okay, I think I'm gonna have to try and wrap us up, but maybe we need a part
Okay.
two because there's
Yeah.
so many things that we could dive into that I've like barely scratched the surface of my questions list for you. But I want
Sure,
to
let's do it.
transition us just a couple of fun questions before I let you go.
Yeah.
Okay, what's your favorite food?
Oh, dang. I don't know. I really like food.
Or a
Um,
few. You
I
don't have
love,
to pick just
yeah,
one.
I love sushi.
Mm.
I
What's
really
your
love
go-to
sushi.
roll?
Like anything with tuna,
Mm.
like a raw tuna, like tuna in the middle and tuna on top. I'm probably
Double
gonna pick that
tuna.
one. Yeah, double tuna for sure. And then I really like a good pasta dish.
Me
Love
too.
pasta. Yeah. Love carbs. Yeah, I also really I like salmon a lot too, and shrimp. I love seafood, oysters. Yeah, I really like it all.
Yeah. Well, we could chat food all day too then. What is your favorite workout?
Oh, right now, honestly, probably like walking with my weighted vest on,
Hmm.
just really trying to. I have three little kids, so if there's a time where like I can just get out and like walk, like if I can actually do it, that's like I'm like, okay, I did it. Just if I could do
Yes.
that. But used to before I had children, I enjoyed running. Um, and I ran a half marathon, was
Oh, which
inspired by my
one?
friend who is the one in Nashville actually.
Yeah.
Yeah, the rock and roll one. Yeah.
Uh-huh. So
My
cool.
one of my really good friends in med school is a runner. She did like the Chicago Marathon. I mean, she's
Oh,
awesome.
wow.
I love her. And she really encouraged me in medical school. We lived together and she was like, you can do it. Like if you can run like a few miles, like you can do it. So we would just
Yeah.
go together and we would just be chatting and it was great. Yeah. I wish I could do that now. But
Oh, so
yeah.
fun. It's fun to go with people too. Like you said, the miles just click by when you're chatting away.
Yeah, yeah. And like if anybody if I can do it, like anybody could do it for sure. And then I used to be I still do, but I haven't been to a class in a long time, love Zumba a
Oh,
lot.
yeah.
And I used to be a Zumba instructor for a little bit in
Oh,
my past life.
fun.
But yeah, I love Zumba.
Yeah. So much fun. It's like a dance party.
Yeah.
Okay, and then maybe this is the same thing, but what's your favorite, like, I don't know, I don't always love the term self-care, but like thing that you do for yourself that's like just for fun?
Yeah. Oh my gosh, this is such a good question. I need more of these. Maybe people can suggest for what things I can do for myself. Honestly, sleep, I value my sleep so much.
Yeah.
So just having like an environment where I can go to sleep, like if I can go like take a bath,
Hmm.
and then I like have my whole sleep set up with my weighted blanket and everything and the air on like
Yeah.
68 and get under my weighted blanket and then have my little eye mask. It's like a little massager eye mask.
Oh
And
man.
yeah, that is, and I have like my little knee pillow and everything, and then maybe like read a book and go to
Yeah.
sleep. That's
Yeah.
like right now my self-care right now. Yeah.
Yeah. That sounds lovely. And as we're chatting this evening, I'm sure
I know
you're
you're
ready
you're
for
like, I'm ready
it.
to go to
Like,
sleep.
I'm ready to lull myself to bed now. Wow. A
Yeah,
massage eye mask. I'm gonna have to look into that. It sounds
you need
divine.
to. You need to. It's so awesome. Yeah.
Amazing. Well, Lauren, thank you so much for your time. I will
Yeah.
probably have to bug you again later so we can continue
Yeah.
all the questions, but I know this is going to be so helpful for people who are listening to
Yeah.
learn more about this area of health, learn how to be an advocate for themselves, where to look for the doctor that works for them. So, thank you so much.
Yeah. Thanks for having me. I'll come back anytime.
Thank you so much for tuning in to this episode of the Health by Haven podcast. If you enjoyed today's episode, please be sure to give the show a 5-star rating and leave a review. It makes such a huge difference in reaching new people and spreading the joy of healthy living. I would also be so appreciative if you subscribe to the show in the listening app of your choice so you never miss an episode. Your support truly means the world to me. Have a happy, healthy day, and I'll talk to you again soon.